A confident recommendation from a treatment coordinator goes a long way toward helping parents feel right about the plan prescribed for their child. They came to you with their problem and expect you to have a solution. They may only know about their problem on one level, but when you educate them, explaining consequences of untreated malocclusion, your solution takes on more value. The following video demonstrates how a typical consultation can go with a teen patient and her mother. Notice how the treatment coordinator uses all the tools at her disposal, including the Invisalign Teen PowerPoint, ClinCheck, and Typodont models. She always makes sure to directly address mom's concerns while emphasizing the key points that matter to parents: efficacy, compliance, and hygiene.
Welcome, ladies, to Smith Orthodontics. Thank you for taking the time to schedule your consultation. Have you seen an orthodontist before?
Yes, we've actually been consulting with multiple orthodontists.
Great. So Megan, what would you say your chief concern is when it comes to Molly's teeth?
Well, Molly has some spacing on the top and some crowding on the bottom.
Oh.
And we really need to get that fixed.
Great. Well, spacing and crowding make her an excellent candidate for Invisalign Teen or traditional braces. Do you have a preference for traditional or Invisalign Teen?
What's Invisalign Teen?
Now, the difference between braces and Invisalign Teen is very simple. With traditional braces, we have a stainless steel bracket that is bonded to each tooth and then bound together with one wire. The wire is then engaged using these little rubber ties called ligature ties. Invisalign Teen is a little different because you can actually remove the appliance. Okay? Invisalign Teen is made of a clear plastic material that we ask that you wear that 20 to 22 hours a day. After wearing each tray for 2 weeks, you're done with that tray and you move to a new tray.
So if she can take off the aligners, how will I know if she's wearing them enough for it to be effective?
That's a great question. Each Invisalign Teen aligner is equipped with a compliance indicator. And what this is a blue indicator button that will fade over time the more hours she wears it. Now, it's very important to understand that compliance is very key with any orthodontic treatment. If you are wearing braces, it's very important that you do wear your rubber bands and also headgear if that's prescribed, and you do show up to your appointments on a timely manner, or it's not going to work. The same thing with Invisalign Teen. If you don't wear the product or you lose it, it's not going to work.
So what happens if she does lose an aligner? How much is that going to cost?
That's actually a very good question. We provide you with 6 replacement aligners at no charge. So if she were to lose an aligner, you would call our office and we would order you a new aligner. Now just remember that if you do continue to lose aligners or you're not wearing the product, there is the option to place braces, but it will incur an additional cost for you.
So, do they hurt a lot? All of my friends with traditional braces say they get headaches after their wires are tightened.
That's a good question. With the wires, you know, your adjustments are, like I mentioned, every 3 weeks. And sometimes we can get some pokey wires where we'll give you some wax material to put over the wire, and that should eliminate any pain from the wires. The adjustments are actually when we change the wire itself. And that could actually sometimes cause a little bit of discomfort, perhaps a little pain, but nothing that won't subside in the next couple days. With the Invisalign Teen, there are no adjustments. Each aligner will place a little bit of pressure against your teeth, but as you can see, there are no pokey wires or anything that will pinch or irritate the gum tissue. What I would suggest with the Invisalign Teen product is when you change from one aligner to the next aligner, you do that at night right before you go to bed. And that way, all of that pressure that you'll feel, you will typically sleep through the pressure, and once the morning comes, you won't feel it at all. It's actually very comfortable.
Okay.
Okay. So Megan, how is Molly when it comes to brushing and flossing?
Well, she's pretty good about brushing, but flossing, she does okay.
Okay. Well, you need to know that during your orthodontic treatment, it's very important that you maintain good oral hygiene. It helps prevent any decalcification, tooth decay, and eventually gum disease. With traditional braces, we will give you some tools to help keep your teeth clean. Some tools include mini micro brushes to help dislodge any food that can get stuck under and around the brackets. Also floss threaders. Floss threaders will help weave the floss under the wire in order for you to efficiently floss your teeth. With Invisalign Teen, you won't need any additional tools. You simply remove the aligner and brush and floss as normal.
Will they make me talk funny?
You know, when you first get your initial aligner, you might feel a little bit of a speech, maybe a slurring in your speech or maybe a lisp, but typically within 3 or 4 days of wearing the very first aligner, your tongue will acclimate and you won't feel any different when you talk.
Okay.
Okay.
So Molly is very active in soccer and also plays the clarinet. Is she going to have to take off the aligners in order to participate in those activities?
Molly will not have to take off her aligners, nor will she have to take off the braces in order to participate in activities such as soccer and clarinet. With braces, we would suggest that you wear some sort of mouth guard to protect your cheeks and your gums and your lips during activities such as soccer and the clarinet. You should be fine. With Invisalign, you can still wear the Invisalign while playing any type of sport, any type of instrument. In fact, if you do have a special engagement, a party, a prom, senior portraits, you know, you can take the aligner off, have your event, take your photographs, and just be sure to put it right back on when you're all done. Megan, if you choose to move forward with the Invisalign Teen, what we will do is take an impression of Molly's teeth and also an x-ray. We will send that x-ray and impression to Align Technology where they will CT scan it. Then they will create a 3D image on the computer called a ClinCheck. This ClinCheck will allow us to see virtually the malocclusion that Molly has. Now the doctor and the technician will then simulate the movements of the teeth into the proper position. As you see on this model, we will place what are called attachments onto the teeth. These are tooth-colored material and they are bonded to the tooth in order for the aligner to have something to grab onto. Also, throughout treatment, we might perform a procedure called interproximal reduction. And that's where the doctor will go in between your teeth with a very small file and create micro gaps. This will help facilitate the tooth movement as well. When the doctor is finished changing and creating this model, the aligners will take about 3 to 4 weeks to arrive in our office. Once they arrive, we'll call you in, we'll help you place the aligners, and we'll teach you how to brush and clean the aligners effectively. Then we will see you every 6 weeks for your follow-up appointments. Are there any questions you have?
No, I think...
Great. At this time, I'm going to take you out so that you can meet the doctor and he can do a full evaluation, and then he'll give us a better idea of how long the treatment's going to take. And depending on the treatment time, you and I will sit together and talk about the fees and all the payment options that we offer in our practice.
Now is your chance to make the doctor look really good by relaying all the pertinent information about this case and sending him or her in well informed. Include the patient's chief complaints, lifestyle info, treatment preference, any hesitations and expectations they have shared. Leave the doctor's bio slide from the PowerPoint up on the screen while you're out of the room, so the patient and parent can review the information.
Ladies, welcome back. So, in our initial consultation, at the beginning, you told me that your main concern for Molly was the spacing in the upper teeth and also the crowding on the lower teeth. So we've taken photographs of her teeth and you can see the spacing here and also the lower anterior crowding. After meeting with Dr. Smith, he feels that she is an excellent candidate for both braces and Invisalign Teen, and he feels that he can correct her malocclusion in about 12 months. So I'm going to go over the fee with you and also the 3 payment options we offer in our office. So for a full orthodontic treatment, whether it be Invisalign Teen or braces, it's going to be approximately 12 months. The fee for that is $5,500. Your insurance is going to cover $2,000 of that, which leaves your patient responsibility $3,500. The first option for payment would be cash or check. We do offer a courtesy discount of 5% if you do pay it in full. The second option would be to finance using a third-party institution. We work with a company called Care Credit. This would be a online credit application that we would fill out, and upon approval, Care Credit would then finance the $3,500. Your option would be to pay them off over 12, 18, or 24 months. All three of these options are interest-free with no down payment. Okay? The third option would be to finance within our office. We require a 30% down payment, $1,050 down, and the remaining balance you can pay off over 12 months. We also don't charge you any interest in that option. So after seeing the doctor and talking about it, Mom, do you know if you'd rather go the braces route or if you'd prefer to do the Invisalign Teen?
I think we would definitely prefer Invisalign Teen.
Great. I'm glad you made that decision. And I guess the next step would be to take an x-ray of your teeth and an impression, and we can send that off to Invisalign and get you started. Does that sound good?
Sounds great.
Great.